uh, guys. I know I have suffered a lot during my journey to MRCS, and I don't want my fellows, my seniors, my juniors to suffer a lot in this journey. Um, Being from middle class family, I understand that how much doctors in Pakistan suffer economically. So that is why we, a group of doctors, started this program just for you guys. And I hope that Allah Almighty will help us to continue it till we are alive. I'm not gonna abandon it at all. I know that many of people are trying to stop it, but it doesn't matter at a lot at all. Many of you guys, those in the group, they have already know me, and they many of them took my for last year in 2023 four we conducted four hands-on sessions, and they know that how we continue. So let's start with you guys very shortly about MRCS B guidelines and all these things. So, today's presentation will be regarding number one course, a study material you need for this preparation and to go through the exam. And one thing I would request you guys, if you people are here, please take a pencil and copy just to make sure that to make necessary notes. So today we discuss the course outlines, then what study material do you need, what is the duration for the preparation, how to prepare, best time to apply for the exam, how to appear, how to attempt knowledge part, and then the skills. So today's this all session will be regarding that, and at the end we will have a question answer session so that if you have any question in your mind you may ask. Okay, so let's start. What's the course outline? So MRCSB exam, we also call it as Mrcs Osce exam. It consists of two parts. Number one is the knowledge part, which consists of 8 stations, and number two is the skills part, which consists of 9 stations. So total of 8 stations here and 9 stations here, and so total there will be 17 stations. So sometime they include 18 stations, but most of the time these are 17 stations. Whenever they include one extra station, they announce that this is not for the exam purpose. We are just introducing a new station just for, you can say, a test. So that will not be marked. Marking is only for 17 stations, make it very clear. So knowledge part of the MRCSB, that is further divided into anatomy, pathology, and critical care, 3, 2, and 3 stations. So this is for the anatomy part. And then each station carries 20 marks. So I'm talking about this knowledge part. Each station carries 20 marks. So it means that there are almost 8 stations, and so there will be 160 marks for the knowledge part. So 9 minutes are given at each station to answer the questions being asked to you by the examiner. 160 marks for the knowledge part, and passing marks. I am gonna see if I'm gonna highlight this one. So passing marks vary for each day as it is according to the percentiles and not percentage. So make it very clear. For example, if the exam is being conducted on 3 different days, like this may attempt was on third, fourth, and fifth. So it will be different passing criteria on third, different on fourth, and then fifth. So it is not that the they will make a cumulative percentage of 3 days. No, it is different for 3 days. However, for the morning and evening stations, it will be same because in the morning and evening you get same stations. So that is why it will be same. So passing criteria, number one, it will be different. Number two, it is on percentile basis. It is not percentage basis. It's not like that if you get 60% marks. So if you get 60% marks, you will be passed. No, it's not like that. Yeah, or if it is to get 61% marks or 71% marks. No, it's not like that. It is according to the percentile. So it is different for every day. Number one. Number two, you have to pass knowledge part separately and skills part separately. I hope all of you have already done MRCS part E. So when you have done MRCS part E, you know that in that exam, you have to pass separately paper one and paper two. If you are failed in one paper, then you are considered failed in the whole exam. It is same here. If you are failed in knowledge part, you are failed in whole exam. Similarly in the skills. So make it very clear. Okay. Then next, what are the parts of the skills? Skills part consists of four different sections. History, communication skills, examinations, and procedure skills. In the history, there will be two stations. Communication skills, there will be two stations, three for the examination and two for the procedure skills. So total of 9 stations, 180 marks, and roughly passing marks. Roughly passing marks are almost 120 for each. It is about not, it isn't just an average, and you can say that a skewer number to pass the exam. Sometime it is 106, 110, 111, 115. So 120 is a skewer number in. Okay. So let's now discuss each and every one. This is further details. This is given on many papers. So I will discuss here for the anatomy 1, 2, and 3 station. This is from the Royal College. 1, 2, and 3, you can see 20 and 20 marks. Then surgical pathology, all these 20 and 20 marks. However, in this applied surgical case, you can see that they have further divided into three. So this is these are three stations of critical scale. So 12 marks for your knowledge and application. Then your technical skills, if they ask you some technical skills, they are divided into further 4 marks. And then professionalism, that is further into 4 marks. So this is how they divide further marking. This is for the knowledge part. For the communication, so for the skills part, communication skills and then clinical and procedure skills, they have further divided these four. You can see these four into further two categories and four subcategories. So you can see here that the maximum part contains, this is the communication, 12, 8, and then 4, and even these technical skills and all these are also part of communication skills. So this is the subdivision of the marks. You can see here on your screen that most marks related to communication and then clinical skills. So, for example, um, this is related to talking with a relative, care, similarly history taking, communication skills, and then physical examination, 3 stations, and 2 stations for procedure skills. So for all these stations, you can see that these two clinical and technical skills and communication, they contain the maximum number of parts. And then obviously the professionalism. This professionalism is also part of your clinical communication skills. So main focus is totally on your communication skills and understanding. So now the main thing, second part, that is a study material. So you can see that a lot of books will be advised to you by different colleagues. But we started this program from February 23. So from February 23 till now, we have conducted 5 sessions. You can see when, and you can ask from your who have passed the exam. This material we are sharing with you, these materials are more than sufficient. Knowledge part, Proki notes, are Sala notes, nowadays Sala notes, and even I have edited Sala notes somehow, and I have added a lot of new pictures, new topics in those, and shared in the groups as well as in the classrooms. For example, you had news station this time, actinomycosis, so different questions. So I have added, I have made different notes for those. Sing notes, these are very important. Sing notes, people give little importance to sing notes, but believe me, these are very important, and I will ask you guys that you should give at least last 1 month to these sing notes. These are not that different from these Sala notes, but they contain almost 20 to 30% extra questions, and the way examiner exactly ask the question or may ask the questions. Mathematics, it is extremely important for the understanding of anatomy. It's very important. Along with that, some people prefer Turkey notes over Sala notes, but my own preference is Sala notes as compared to Turkey notes. We MRCS team, we are trying to make our own notes for, because these, you know that these Sala notes are very costly and not allowed to share in the groups. So we are trying to make our own notes for, so that you people may be helped. So hopefully till November we will try to manage uh, those notes in the market. Hopefully. But having said that, during that duration, you should go through these notes, as well as you should try along with these books like Beckman Atlas and Seeing Notes. So for skills part, this was for the knowledge part. This was for the knowledge part. For the skills part, strictly history from Basit notes. There are 1 to 2 other histories which are not in the Basit notes, and I have shared those specific histories and their stations and how to do go for these. One thing is important related to Basit notes, and even I found it deficient in Sala and Turkey notes as well. These are the notes. These are the questions which are asked from the examiner, by the examiner from the candidate. I show you here if I could. If you can see here, uh, clinical knowledge and its application. In the history part, specifically history and examination, clinical knowledge and its application. These are 4 marks. Clinical, your presentation and all these things. These carry 4 marks for each, you can see. And here in the procedure scale, one station, it is 8 marks. So I feel that they are somehow deficient in answering the questions asked in these skills part later on by the examiner from the candidate. So in the recent sessions, like in our mocks, I tried to cover all these uh, questions and then their question. For example, recently they asked the question in England in one station. The question, for example, ask you the question, why would you do digital rectal examination in a spinal uh, examination patient? Why is it necessary? So some would say that mass, we know that this mass is very important, but the thing is, the main thing which is important here for in the spinal examination, that is the anal tone. And because if there is loss of anal tone as well as the loss of anal sensation, it means patient is going towards called the Aquina syndrome. So this is very important. Similarly, they ask you some of these questions, and this contains 4 marks. If so, uh, in one call station, like in cardiothoracic, call to cardiothoracic surgeon, they asked uh, how to repair aorta. So you should know these stations. So we try to discuss these questions, and these are not well covered in Basi, but all the history and communication skills and examinations, you should stick to Basid notes and GK Medics videos. Believe me, if you master these ones, the exam will go very smoothly, because this is not a consulted exam, this is a basic exam, a mediocre level exam. So just try to go through Basir notes and along with that GK Medics for these 3. For the procedure skills, Andrew Miller, I have shared it in the group. Andrew Miller is very important. And along with that, GK Medics, some YouTube videos I have shared multiple times, the links of those YouTube videos, you should practice from those. And that's all. That's enough. Turkey notes are not recommended for procedure skills. GK Medics uh, videos plus Andrew Miller, that's important. That's enough. And so this is all you have to go. Don't go for past the MRCS and this one. However, if you get some data for anatomy stations, because in the anatomy, questions are 90% the same, but they show you somehow different pictures. So as much pictures you can see related to one question, that will be beneficial. So, for example, you see one picture, cadaveric picture from the McMain, other you see from the, for example, you see from some other atlas, Natter atlas. So you should know that what are the dimensions and where is the muscle or these tendons going on. For example, um, and today I think so, yeah, or yesterday they were suffering with ankle anatomy and all about ligaments. We will try to revise is again and again. We have revised this ankle anatomy and all these things very in details. But you know, there is exam stress obviously, then different pictures, and then a lot of pressure on the candidates. So we will try to practice it as much as we can during these our mocks. Duration of preparation. So duration, I would say that three to 4 months are more than enough. If you prepare for 6 hours a day, then even 2 months will be enough. But as we most of us are already in duties and we cannot secure 6 months, 6 hours on daily basis, so I would say 3 months roughly are enough if you go with the routine. Uh, but these 3 to 4 months, for at least 2 months, you should be in a group for 3 to 4. You should not prepare, never prepare on your own. You should never prepare on your own. Otherwise, you will suffer. Believe me, you will suffer. So prepare in start from the day that make a group of 3 to 4 people, and then start preparation with those guys. That will be easy for you. But why I'm saying that? What is this exam? Is this a written exam? No. Is this an MCQ exam? No. What is this exam? This exam is totally verbal exam. You have to speak there. So if you want speak, you want practice for 3 to 4 months, what happens in the exam? I have already told, and I hope that Dr. Kachu will laugh at it. That I have already told what you will do. You will be translating there in the exam from your mother tongue, like in from Punjabi, Pashto, and all these things, the Urdu, then from Urdu to English, and that you will be speaking, and it will waste your time. Why you will waste your time? Today, one of the candidate told me that what she told me that in this anatomy part, she was asked more than 25 questions in one station. More than 25 questions in one station. What does that mean? You have only 9 minutes to answer 25 questions in 9 minutes. What does that mean? It means you have to answer the question in 15 to 20 seconds. So if you want practice here, you will be practicing in the exam and after 3 months then. Okay. I hope it is understood. So the only thing which matters and which will differentiate between you, the passing, and the one who fails, the only thing which will make difference is the practice, practice, practice. And this practice not only for the knowledge part, but also for the examination part. Whenever you watch any presentation, you should know that the presenter is asserting on which point. I am spending most of the time on this topic, that practice, practice, and practice. So you should know that this practice will make the difference between the margin, on the passing margin and the failure margin. So how will you prepare for the exam? So it's not basically a difficult exam, it is a tricky one. And all the things should be on your fingertips. It's not like that, you know, one thing and not the other. No, everything you are given, I'm telling you, should be on your fingertips. Either it is from Bazid, from Salah, from GK Medics, whatever, it should be on your fingertips, and only then you can be successful in the exam. Till date, till date, no, more than almost 100. I If I count, there are 93 candidates who have passed MRCS Part B exam in this 1 year, and which are part of our group. Either they took our hands-on session or they were in the group. Otherwise, we helped. 93 people have passed this exam till date in this 1 year, starting from February 22 till date. So I hope that we will try to help you in further as much as we can. Next thing is best time to apply for the examination. So best time I always say that is as early as you can after your knowledge part, your part A. When you have passed the part A exam, try to apply and secure a seat as early as you can. Why? Because most of the most difficult part, which people believe, is the anatomy stations. And when you have passed Mrcs part A recently, your knowledge will be fresh. So when the knowledge will be fresh, it will be easy to point because all the anatomy is related to spotting. So when it will be fresh, it will be easy for you to spot the some particular spot to label that in the exam. So try to cure as early as you can after your part A. However, you know that nowadays it is very difficult, specifically in Pakistan. Um, it is very difficult to secure the seat and all these things, secure the exam seat. So try if you can go to Malaysia, Abu Dhabi, Egypt, Oman, all of these conducting exam in different time whole year. So try to uh, secure a seat as early as you can. Thing is, how to appear in the exam. This is very important. So it is a well organized examination. Um, you don't need to carry anything with you like any overall, any hammer, stethoscope, BP apparatus, all this. No, all the things will be provided to you in the exam. You need to carry only yourself in the exam. And people ask me again and again about the dress code. There is no specific, they have mentioned it, a dress code. The only thing you should care is your shirt should be above elbow. That's all. Your sleeves should be above elbow. They don't care if you go even I have seen that some girls appeared in burqa, so they don't mind it even that. So appear in the exam, you don't need anything else. Rather, it is very easy for you to just have an idea that what particular instruments are present in the inside the cube, and what particular examination page the examiner wants, because they have put there the instruments only relevant to the patient examination. For example, if they need hammer, they would have put it there in the cube. Similarly, the cotton, they need if some tuning fork, so they have put already there. So it will become very easy for you to judge that what are you going to perform in the next 9 minutes. So how to attempt the knowledge part, I have already explained that you are going to face 20 plus questions in 9 minutes. So prepare for that. And the only way to prepare for that is practice. How to practice for the knowledge part? This is very important. And please be careful. This is very important. How to prepare for the knowledge part? Make a group of two people. One will be the examiner, the other will be the candidate, and try to practice one station in 9 minutes. That's all. There is no other tool for that. And then you will see that I know the candidates who are in practice with me whole year since almost last 3 to 4 months. They today they completed their knowledge part in 7 minutes. Why? Because they were already well prepared. They know that what question they're going to ask and what is the answer. Okay. So for every station, you will be given 10 minutes. 1 minute will be outside the room, 9 minutes inside the room. So the question will be pasted on the wall outside the room. For example, if there is station one, I have written just a scenario. It is a not miss station. Mr. Harry is a 19-year-old man who underwent RTA and got his right hand injured. Inside the room, you are provided right hand anatomy station. Please answer the question being asked by the examiner. So this question will be pasted outside the cube, and for 1 minute, you have to just have an idea that what question can be asked by the examiner from the candidate and get prepared for those. For the knowledge part, I cannot say, but now again, very important thing. Uh, I cannot say for the knowledge part, but for the skills part, this 1 minute is the key. For the knowledge part, not for the knowledge part, but for the skills part. This 1 minute is the key. If you just could not concentrate reading the question, it is quite a possibility, and it is more than 70% possibility that in the side the cube, you are going to take a wrong history or you are going to perform a wrong examination. Recently, what happened? There was a patient with the shortness of breath and chest pain and hemoptysis. And the candidate was asked to take the history. And what he did inside the cube, he went inside and started secret protocol. This was a station for history, and he started examination for the secret protocol. Why? Because he did not concentrate on the question. So this is very important that you concentrate on the question, what you have to perform in the inside the cube. So for the these stations, specifically the knowledge parts, I have uh, bold, make it bold, quick and one-liner, quick and one-liner answer. In 9 minutes, the examiner won't ask you to explain anything. They need one-liner and sometime only one word. They want to listen from you, and that will be okay. So what is the deficiency here in the different notes? That is a big problem for you guys. Why? Because you people start in the examination explaining each and everything, and then you waste your time. For example, if there are 20 questions to be asked, you have explained fully the 10 questions, and then the time has been finished. The examiner will cross the next 10 minutes, next 10 questions, simply. So what you have to do, for example, they ask you the definition, they ask you the process, just make your own answers. In the books, they have written details. You have not to speak all the details given in the notes. Those are for your concepts. What we practice here in mocks is that one liner, that how to answer the question only in one line, specifically for the pathology as well as for the critical care. So that one liner answer is the key. However, if you don't know the answer to particular question, for example, you can simply ask the examiner that I want to skip this one. And most of the time, the examiner says that, okay, skip. And then at the end of the station, you can ask that I want to answer the skipped question. But if there are the next question is related to the question already asked, then they ask you that no, you cannot skip because the next question is related to this one. So this is how you have to attempt all your knowledge part, uh, knowledge stations. Now comes the skills part. Skills part, you know that there are 9 stations, each getting 20 marks, 180 in total, uh, and 120 is the secure score. So, what are the key points to pass in the skills part? Number one is that 1 minute is the key. Read the question very carefully and then revise all the steps in your mind accordingly. For example, if they have asked you that this is the patient you are going to, they will not ask you in the exam that um, do the cranial nerve examination. Maybe in some question they ask, otherwise not. They will ask you to do the relevant examination. They will give you a scenario. For example, they'll say that this patient presented with chronic leg pain for the last 3 months that uh, increases with walk, and then do the relevant examination. So you are supposed to do here peripheral arterial examination, and then they will give you another scenario. The patient is having leg pain for the last 3 months. That is decreases when the patient goes upstairs, or that is radiating from the back, from the spine. No, you are going. They will ask you to do the relevant examination. So this 1 minute is important. You read the question very carefully, and then you inside this cube, you then judge that what are you going to perform. The station will be essentially same as you will be taught here. Hence, just consider it as a rehearsal of your previous practice. It will be nothing different. History and examination will be consisted of 6 minutes. So this is important. History and examination stations, they will be of 6 minutes. You have to take the history and complete your examination 6 minutes, then 0.5 minutes or 30 seconds to summarize your history and examination, and then 2.5 minutes to answer the questions. So this is how the 9 minutes will be completed. However, in secret examination, they will give you whole 9 minutes to complete the examination because the viva goes side by side. Uh, but procedure skills and counseling stations and procedure skills, most of the time they will give you whole 9 minutes to perform that particular skill. For example, suturing and other things, and then the viva goes side by side. Similarly, in the counseling is essentially of 9 minutes. So the communication skills, this consists of two parts: communication with the patient and communication with the colleague, either the registrar of ICU or the thoracic surgeon from other hospital, a surgeon from your own consultant. So this is communication with your colleague, and other is communication with the patient, counseling of the patient or the of the attendant of the patient. So both of these stations will be of 9 minutes. Both of these stations will be of 9 minutes. What they do in these stations, they will give you first 9 minutes to read the chart of the patient completely, and the next 9 minutes they will give you again to reproduce that chart, either to counsel the patient or to communicate with the your colleague. That is how this particular station, these two stations are arranged. What I believe that uh, at your level, you should not lose your marks in either of these, neither either in the communication and in the history, because these are the stations which are totally dependent upon you, and only the communication skills plus your knowledge. So it is not subjective at all. It is totally objective. You do the right things. You uh, do the good history. You take good history. So it is totally dependent upon you. You should not lose marks in this if you are already well prepared. But believe me, now you will uh, be laughing at me. Believe me, because we were the second group who appeared in this exam. It was the second attempt in Pakistan. First was in I think so May 22, and second was in November 22. So there was no guidance at all. So my whole of the this communication station call to the consultant, that was ruined, that was destroyed. After I think 3 to 4 minutes, he uh, even cut the call and said, "Okay, why?" Because I did not know that how to read the file, how to read that chart. That was different font Italian, and what was then with the chart again, as done with some colleagues yesterday, they had put the charts separately. One was the which what the patient's file and patient history and examination details, and other was with the patient's like you can say vitals or patient's fluid, patient medication chart. So those were two separate charts. So we were not told that which one to be done first. So I spent my 6 minutes in calculation of the fluid of the patient. That was not to be meant at all. And then after 6 minutes, I realized that there's another chart as well. So the and those 3 minutes I quickly went. I did not know even that patient was post-op and pre-op. I was telling the patient, the consultant about the pre-op patient, while the patient was post-op. So, but now you have full guidelines and each and everything available. But even after that, that my whole station was ruined. I passed the exam. It means if your one station is bad, it will not affect your result at all if you are good in others. So this is all from my side for today. If you have any question, you are most welcome one by one. Yes, one by one. Yes, Dr. Shafiq. Yes, Dr. Shafiq, you are mute.
Yes, I want to add something that I recently took exam in Feb attempt. I failed by 1 mark in skills and communication. The main reason was that in the call to the surgeon, vascular surgeon, they put the ECG separately. It was not in the file, so I did not know what other investigation he was talking. What other investigation? have you got? He was actually asking about the ECG which was present on the table just behind the phone. It was not given in the main file. So I want to say that you must look
Exactly.
uh,
Exactly. Thank you, Dr. Shafiq. Thing is, recently happened it yesterday that they had put one separate chart with fluids, and there was fluids and investigation, all these things, and other chart was with history and examination and procedure, all these things. So there are most of the time there are two separate things. So you should go through all these things, and they ask you about those things, about history and about those investigations.
yes.
Thank you so much, Dr. Shafiq, for your feedback and the guidance. Okay, anyone else? Dr. Shafiq, don't worry. Failing by 1 mark is just, I can say, a matter of luck, not related to your work. Uh,
Yes, I performed very well in knowledge. I got 130 and skills. It was just a communication part where I lack. I don't know where it went wrong. First, I realized by this mistake I don't get the ECG. The second was with I don't know where I went wrong. Maybe sitting or setting or something like that.
Maybe, but we'll make sure that next time you appear in the exam, we will try to prepare you well, and then you can even assess yourself and analyze yourself. That where you are not up to the mark. I have even my candidates. One of my candidates, she scored 158 marks in the skill. Can you imagine it? 158. And in the knowledge part, she failed by 1 mark.
Very sad.
So, so doesn't make any sense. Or you can say that just matter of luck. Okay, if you have any question, you can